Hello, hello. Happy Monday. Today is going to be a good session. We are going to be doing a little bit of combination here for the next few sessions this month. I just want to make sure I'm coming on the end. Today, we are combining. Good. Okay. So, if you are joining me today and you have any chronic issues at all, I would really like to encourage you to ensure that you have a stool, as I do. And today I'm going to be adding a couple of things. I'm going to be adding some red light. I'm going to be using my large red light panel. And I am also going to be adding some weights. The weights are not a have to be done, but they are a progression if you're looking for more challenge on some of these exercises. For those of you that are looking to get the heart up, as I promised I would do today, join 2 secs. Perfect. Okay. So we're going to get, and hang on a second here. Sometimes I don't know if it's the connection or if it's my camera. Okay, so today we're going to start with a few seated warm-up exercises. They're not going to be necessarily easy depending on where you are at with your health. Combining technologies is a great way if you are short on time and you want to save some. They're also ideal, perhaps you are in the healing or recovery phase of something and you want to accelerate benefits. So combining red light with exercise or using red light before or after exercise or activities is a great way to accelerate not only wound healing. We've talked about wound healing, how it boosts the mitochondria quite a bit, but it accelerates recovery. So if you are a training athlete, if you are post-surgery and you would like to reduce recovery time, many times we don't spend enough time recovering and giving our, especially if you're dealing with a chronic issue, you've got inflammation, you need to make sure that you're giving body time to recover and implement all this work that you're doing. And that's why good sleep is also very important. I think I can widen up my screen here. There we go. And if you are joining me, oh, hello, Vicky. Thanks for joining me. So I know you can see and hear me at least on the other end. I'm hoping that's the case. Let me make sure I got my volume up. Never know. But red light is also, if you are post-surgery, a lot of us talk about it as a wound accelerant healing thing. This red light, sort of rule of thumb thing, skin surface and just penetrating a few millimeters into, which is great for boosting that lymphatic fluid that lies just below the surface of the skin. So while I'm doing a workout with you today, I'm going to allow the red light to cast upon me. I don't want to get into a whole debate about how close, how far away. We cannot control how close or far away we are from the sun. So I like using red light and casting it upon me for a couple of reasons. For me, it's kind of like additional caffeine. I like adding red light, especially in the morning. If you deal with seasonal things, it's a really good cognitive thing. mood lift, if you will. And if you have other types of wearables, so I've dropped a couple product recommendations. I don't know if I did that right, but I was playing with our back-end streaming today, and another popular add-on when people are doing their vibration plate are wearables. So things like the red light belt is a really good example of something that you could wear. I know some of you have been wearing the new neck. So there's all kinds of different ways that you can incorporate red light therapy into your workout to reduce time and increase benefits. Red light is also known to reduce muscle pain, inflammation. You know, inflammation, if you really want to spook yourself, is one of those things that, believe it or not, is actually caused when you exercise and when you do therapy. Old school, we would refer to that as the tear and the repair. You know, as your muscles are exercising, they need that recovery for the repair piece, and red light is awesome for doing that. Many of you are probably going to leave comments and bark at me because I'm not going to be wearing sunglasses today. That doesn't mean I'm going to stare directly at my red light panel, but as I'm 52 and the magnification in my little readers is ever increasing, it seems, more and more of you are commenting to me, and there's more and more studies out there about the improvement of ocular issues through red light therapy. So I'm not pretending to play an eye doctor today, but I know many times when I have it in my peripheral, my vision, I don't know if it's a mental thing or if it's actually me, but I kind of jump somewhere between a couple of different magnifications depending on what I've done and what time of day it is. So because I don't like wearing things on my face when I'm shaking on the machine, I have the larger panel set up just off camera. Okay, so that is going to be casting towards me while I shake. I took my glasses off, so of course I can't see. I'm only using red light. That might be a little too much for you guys right there, I'm wondering. Okay, that's better. Okay, so, and what I'm going to be doing today is I've got a few exercises I'm going to walk you through. Some of them I'm sure you guys are familiar with. This looked so much better when I did my camera test setup here earlier. And if you are unable to do all of the exercises today, the reason I have a chair here or recommend you have it during your sessions is if you do need to take a break, you know, if you're pushing yourself, which is good, that's how we change the body, and you find it's maybe a little bit too much for you, then you can, you know, maybe take a break and do some of the exercises if you're not comfortable doing all of them. Hang on here. I normally have it set up on the wall there, but I want to make sure that you guys can see me adequately. I feel like I'm doing shadow puppets today. I don't like how this looks now that we're set up here. Hang on just a sec. Okay, that's better. Okay, so what we're going to do as a warm-up is what I call a seated cat-cow. And a seated cat, there's all these yoga chair exercise routines. Roseanne's done a few. I'm sure Amber has as well. I have a different approach to using the machine. I prefer using a faster speed or program, but with closer feet, less intensity. So I'm going to set my machine in the 30 to 35 range. My feet are positioned hip width apart. If you're dealing with anything chronic, swollen joints, arthritic, anything, and high impact or long durations is not your friend, you don't want to be here. Wide is more movement, max impact. So think functional. Feet about hip width apart. You can play with the intensity of the vibration depending on the position that you're doing. You may want to change it up as we go along. The first exercise, the seated cat-cow, you want to make sure you've got something that you can hang on to with your hands. And we're simply going to push the chest forward, arch the back. I suck this way flexibility-wise. And then we're going to do the opposite. And for the opposite, I want you reaching, resting the arms, the wrists on the knees, and feel like you're like a puppet, like somebody's pulling those shoulder blades up to the roof. So we're going to arch up like a cat. And then we're going to come back, do the opposite. Okay. If you feel comfortable doing this, this is probably a good idea. You know, this might look like you when you're sitting at your desk, just some of the moves that you're doing. I would like 4 to 5 good reps on this. And then we're just going to do some slight, sort of a seated calf raise, but we're going to add what I call the lifting of the ball of the foot. So we're doing foot pumps. So we're coming up onto the toes, coming back, lifting the balls of the feet. Okay, forward, back, forward, back. Again, just want to get some range of motion going for some of the meaner stuff I'm going to subject you to later. Okay, the next one we're going to move into is a spine twist. So we're going to keep our feet positioned. We're turning at the waist. We don't want the butt cheeks coming up off the chair, but we're just going to take this opposite hand and we're going to try reaching over, back, and hold to heart. If I like to reach back with my arm, you may feel comfortable grabbing onto the chair. Other side. Try and keep a nice straight, we don't want to be all slouchy. Nice straight core. Take the opposite hand. Two to three good reps on this one as well. Reach, reach. Okay. You're going to have one side that's got more range than the other. It's just always the way. Okay. Wanted to warm the arms up a little bit because we're going to be doing some seated weighted exercises. I've been talking lots about weight. I had someone honestly think that I insulted them about adding mass. I didn't mean to your frame. I meant with hand weights. Adding mass to your body weight. There's all kinds of things out there about body weight training, body weight exercise, the benefits of it. I talk about it every session. But by adding more mass, for those of you that lack maybe some range of motion, you know, maybe you can't stand for long durations. But Debbie, I really want to work upper body. A lot of times when you're seated, the legs are getting lots of good action, but unless you purposefully do something with the arms, you know, you're not really getting much more than movement. So I'm adding 15 pounds a side, seated, okay? And all I want you doing is we're going to just do some very slight lifts. So we're going to lift, hold, 2, 3, back down, 2, 3, lift, 2. I guess you could even go as far as calling it a curl, but I want very slow, controlled movements on the way up as well as on the way down. Don't just drop the weights, okay? Slow, purposeful. Lift, let go. Lift, let go. For the next one, I'm going to have to drop one weight. Okay. So what I'm doing here with 15 pounds, I just want to change our body weight, and we're going to do reach out in front of us with the weight. So whether you're using strap-on weights or barbells or dumbbells, you know, 5 to 10 pounds, we're just going to hold, 2, 3, back down. You can just rest it on the knees. Oh, listen to the weight shake. Lift, 2, try holding a good solid core. Focus on that breathing. Hold, 2, recover, 2, 3, out, 2, 3, back, 2, 3. If you do not have weights at home and you want to start building up, you know, above the waist, but you need to spend some of your time seated, this is a great way to get a little bit more direct strength training to the arms, especially where maybe you lack function to get down on the ground and do push-ups and more direct things like that. So the next we're going to press to is standing, and we're going to get into some mean stuff. So if you do have fatigue, you're dealing with symptoms in any way, keep your chair handy. I like to keep my chair handy as a technique thing. You know, when I'm pushing you to go low into your squats, you can use your chair as a guide, as somewhere to hit. If your range allows you to go lower than the chair, I suggest getting it out of the way. Okay, so the first one we're going to practice before we start adding some mean stuff back to this. The whole time we're doing this, our red light is boosting other benefits. As I said, We know the vibration plate accelerates recovery, but as does a vibration, adding your red light therapy. For those of you that are like me, that are 50 plus, I'm not only worried about my tone and my strength, but I got a few wrinkles. I got a few fine lines starting to show up. Go figure. So do my squat. I'm going to do my squat, and I'm going to hold still. I've been doing lots of shoveling, and my knee's kind of bugging me. So if you have chronic issues, you do not have to move. You may find when you're not moving and holding a static position, your technique actually is a little better. You can kind of focus on where you feel it. All the while, I'm doing my little wrinkle treatment. Our red light also boosts, it kind of charges up our fibroblasts, and our fibroblasts are what produce collagen. That's a word most people recognize. So yes, it boosts those fibroblasts to create more collagen. It helps with the skin roughness. Maybe you're dealing with psoriasis or something else as well. But for me, it's about the wrinkles and the fine lines. Now, I can hold a squat for about a minute, 2 on a good day. If you're like me and you're finding that easy, we're going to add some weight to that, and we're going to add a couple of variations to those weights. Okay. I probably overcommitted again today. I forgot to change them from last session. So if you're finding in your squat you're not fatiguing all that quick, adding mass is a great way to just make those quads, those glutes, fire up and burn more calories. If you want to make it a little bit more functional, bend the elbows just slightly. So it's kind of a variation on a bent over row. We want to keep those elbows back. We're not looking like this. Keep the elbows back, and we can tone those bat wings at the same time. So let's try adding a little bit of movement. So the knees are slightly bent, and when we go down, we're going to lift with the weights, and we're going to try for 3 good reps. Are we ready? 1, 2, 3. So we're going to go 1. I've talked 10 minutes. My red light shut off. I'll turn it back on here in a minute. 2. Hold. 3, 4, 5. 1, 2, 3, 4, 5. Okay. You could also do some other variations. I gotta turn my light back on. Maybe you want to work more on some bicep strength. So you can go into that squat, and maybe we're just doing some lifts. Core is nice and engaged. You could try both. I think you'll find lifting both is harder. You feel it more on the back. Your body, the whole while you're doing these exercises, guys, we're boosting circulation and lymph. We're boosting our flexibility. We're boosting our balance. We are building our bones because we're burying our mass. That's a big question I get lots. So there's other benefits besides calorie burn happening today. So that's just a few examples of how you can incorporate some additional weight. If you did want to do more, you want to get to more of a calorie burn, more of a cardio session, there's 2 paths we can take. We can do kind of like a circuit. I won't redo the seated exercises, but we could redo another squat. We could do another series of the bent over rows. If you just wanted to, another minute or 2, you want to push, you're short on time. That's a lot of the reason I like to do this. We can also add one more really mean position. I need a slurp of coffee. Excuse me. For this one, I want you to really kick in that proprioception. Really pay attention to where you are in space on this plate. And before we make it hard by getting into what I call the super squat or the Superman squat, we've been doing all of our exercises with our feet at a mid position. We've probably warmed up a little bit. Speaking to those of you that like a little bit more challenge, I would like you to keep your feet at the same position, but let's take the knee and the toe and angle it 45 out this way. So if I'm on the Rumblex Plus model right now, so the balls of my feet are between the outer 2 dots, and my heels are underneath. So we're at a bit of an angle. So you want to make sure the knees follow. You're going to feel this more in the inner and the outer. Take your weight, backpack, whatever it is that you're doing. And we're going to go down and just hold this out in front of you. Good core. Keep those shoulders back. I don't know how low you can go, but hold until you can't hold no more. Maybe the muscles aren't fatiguing, but the technique is you're starting to wobble. That's also a sign to take a break. You could add 1, 2, even 3 reps of this if you're enjoying this exercise. Or as I said, you could do a repetition. I prefer personally doing 2 to 3 exercises I do really well and just repeat them versus a whole big elaborate routine. And then I can more easily gauge my fatigue levels as well. So we've done a little bit today that presents some challenge on the core and the low back, and especially for some of my guys that are dealing with low back issues. I want to do just a little bit of a wind down, which I normally don't do. The plate really does do a good job of expediting that recovery, but I got a little bit more time today. So we're going to bring it back up to that 30 to 35 range in oscillating. We're going to keep our feet hip width apart, and we're just going to do 2 exercises as a wind down. We're going to do some little pelvic tilts, and then we're going to do a toe touch. Just have a nice stretch, not only for the back, but the back of the hamstrings and the calves. So knees are slightly bent. You shouldn't hear it in the voice. If you do, you're standing too tall. Bend a little bit and you'll feel it dissipate. And what we're going to do is we're just going to tilt the bum forward, clench those butt cheeks, hold, 2, 3, tilt back. You'll feel that stretch in the low back. Hold, 2, 3, 3 to 4 reps of this. If you're working on pelvic floor strengthening, incontinence, feel free to add Kegels to any of your standing exercises. And again, a reminder, all the while, we're building those bones. We're making the muscles stronger. Why? Because we're bearing our mass. We're standing, having to hold ourselves up. Okay, so for a toe touch, if you've never done one before, bring the heels just slightly towards the center. Lean over slowly. Now, you do not want to bend the knees. This is not touching your toes. Okay, keep those legs straight. Maybe this is as far as you can go. This is one of those exceptions. Yes, you can lock the knees. Keep the feet closer together. Reduce the amount of impact. And we're just going to hang. Or for those of you that are super flexible, hold, 2, 3. We're going to come back up. Once we get to about 90, we can bend those knees slightly. Loosen things up. If that was super scary and you need something to hang on to, or you didn't do it at all because you thought, no way, turn sideways. This is called a transverse balance. So instead of you moving this way, we now are moving in a different fashion. We're going to turn lengthways facing. Heels are in the middle. The heel is the point of contact. So wherever your heel is planted, that's where it's going to drive the movement. And just then you have your stool, just as something to hang on to. Get used to the exercise in an easier way before you turn, especially if you're not dealing with good stability, balance, fear. Balance and stability are they're almost an immediate benefit of using a vibration plate. And again, we're today combining the effects of red light therapy as well as vibration plates. And a lot of them have similar benefits. It really does boil down to you, the user, and your preference. And what are you actually going to use? The biggest thing with any of the therapies that I'm going to be combining over the next coming weeks, the common thing and the common reason that I like to combine therapies is I'm short on time. Sometimes if I have more time, I might do a longer sauna session, or, it certainly isn't going to be a longer workout. So I like to combine my activities, and I prefer the panels, the bulbs, things where I can, do not have to physically touch it or feel it. And those types of red light therapies are awesome if you are a care provider. Sometimes there's different sensitivities when you're dealing with health issues. Sometimes it's mental health issues. Putting a wearable like the belt or the the face masks. It really depends on you personally. So when you're considering about, well, if I want to get some red light to combine with my vibration plate, because I want to do something like that, are you looking for total body treatment, kind of like what I've done today? Are you looking to treat, an old injury on a regular basis, or preventative? Maybe you've had some surgery or an illness in the past where you've got some compromised areas. So think about, how you visualize yourself using it. It may be for everybody in the house. And sometimes it's not always the biggest or fanciest. Sometimes it's something that you're just going to be treating on a regular basis because you got a bad knee from football or something back in the day. So sometimes it depends on what you're using it for. So think about that. Obviously, something like this or the red light belts, if you want to combine with movement, like the plate presents, there may be some that have better, incorporability than others. And if you are caring for others, sometimes the less you have to touch and feel and physically manage on your own as the care provider, that's where some of the hands-free type of devices are really, really key. And of course, if weight loss is a goal, or toning, or things like that, infrared, which is something we'll talk about in next session, is always another light therapy that I highly recommend considering as a before and or after. So when would I use my sauna if I want to lose weight? Well, where are you at physically right now? Are you having restricted movement? Or do you suffer from fatigue? If you are someone that needs lots of recovery time between activities, it really depends on where you personally are starting at. I would suggest for those of you that are in a little bit better shape, you work out regularly, that you might find and enjoy a sauna more as a recovery. And that's part of the reason some of the panel lights offer the infrared as well. So you could absolutely, you've done your workout, you've done your red light, you could do an infrared session now if you really, really wanted to. You really can't overdo red light. You can overdo the vibration plate. You can overdo infrared. So each of them have their own, fatigue levels within your repertoire. So just keep that in mind. I like using the red light with my plate earlier in the day for that, wake me up effect. And I find it's minus 30 Celsius here today. So I like the warmth that it provides as well. Sabrina from Ireland. Hello. So thank you for joining me. Hello, Vicky. I'm glad you worked out with me. A little bit of talking in the middle, but there's always a tweak or something different. There's an endless amount of ways you can modify some of these positions. So I hope I gave you, I was going to use my Relax-A-Vibe day today just to match you, but I forgot before I was already set up to do my session, and I wasn't going to slug that thing 2 minutes and be winded before I went on camera. Sabrina says, thank you as well. Not sure what model you're using. Today I did our session in oscillating, as I always do. I look like a ghost because I have some lights back on, but some not on. When I like using oscillating, because it is the one movement that all of Life Pro's machines offer. And it's the most functional, it's the most researched, it's what started it all. And I'm not going to get into a whole debates. One is not better than another. There's lots of different vibration plate movements. There's lots of, this one that I was working on today, the Rumblex, has 3 different movements. Perhaps you're working with something more basic, a waver or a mini. A lot of times if you are dealing with health concerns or mobility issues and you're at home and you're caring for yourself, sometimes a smaller model is more portable, and here's me nagging you, use it all the time throughout the day for symptoms. Well, if you're listening and doing that, maybe you want it in the bedroom in the morning when you get up to get started, and maybe you have it in the kitchen later on during the day or in the living room. So when you're selecting a vibration plate, when you're selecting red light therapies, I really want you guys to be honest with yourselves about what you see yourselves using. Be realistic. No, I don't expect you to return the mini waver and get the Rumblex because you have more features. It's not going to show up and do the work every day. That's on you. So for things like weight loss and toning, today's kind of overall theme was combining for my own reasons, but I know many of you like to combine for accelerating weight loss benefits. You guys got to be honest. If you're not giving your body the fuel and the rest it needs, anything you're doing in the realm of exercise, it's going to be short-lived to a degree. And you don't need to be a big exercise guru. The best results, I've talked about this many times, that I see on the plates are always related to consistent use. So get used to using it. What type of movement, what program, a lot of that boils down to personal preference. It feels different to each of us based on our stature, our conditioning. And, if you want to lose substantial weight, I think you can be honest enough with yourself and know whether you're going through the motion and deserve those type of results, or if you're just messaging Debbie wondering what setting is best for weight loss, and just doing it 5 times a day for 20 minutes. You can't go longer and longer and expect better results in every situation. A lot of times, especially for those of you dealing, with joint inflammation, poor mobility, it's just not realistic. And you got to build up from where you're at. I don't want you guys jumping, 20 years back in time and doing things on your plate that's going to accelerate the benefits and dramatically reduce the amount of time that you have to spend doing the exercise. So, pick 2 or 3 good exercises out of the repertoire that I did today. If you are seated and you're going to be there for a while, or you need to do a combination, as I recapped, adding some weights, there's many soup cans, whatever you have around the house. If we push or stress the body to do more, it's going to perform better. It's going to make the bones stronger. If you're just going through the motions and not really expecting it to do a whole lot, it's not going to improve itself. So push yourself how you can. Move often. Keep moving. That's the only thing that's going to keep that lymph and circulatory going. And where you don't feel like it or don't have the ability, that's the advantage that a plate's going to bring to the equation every time. Weight-bearing benefits and long-term. I know many of you are looking at bone density, but I talk about that as a longer-term goal, because there's a lot of things you can be doing in the interim. And every time you step up onto this thing, every time you stand on your feet and bear your weight, that's how you're increasing your bone density. You're forcing your bones to do their job. And if you force your bones to do their job a little bit harder through weights, through movement, through additional activities, that's where we're going to start improving in the long run. So I hope that was helpful today. I want to make sure I covered all my points. Of course, as I said, I'm going to combine over the next couple of weeks a few different things. Today was about combining red light with vibration therapy. I love it for boosting the common benefits that both have. They have synergistic effects with each, more optimal outcomes, we would say, in a clinical environment. And for those of you that are working in a clinical environment or a wellness office, medical office, you're short on time. So sometimes if you've got vibration plates or treadmills or other tools that you're using, incorporating red light as an additional service to give your clients, your patients, more optimal outcomes, more benefits. And it's not something they're coming to see you for every day. So if you can accomplish more in less time, that's value add for everyone. So thank you for joining me. Teresa, I used the turbo today. What program is oscillating? Oscillating is the first default. Turbo, I love. I actually like combining pulsation if I'm going to do anything. So yours has oscillating and pulsation, which is a very mild setting. Maybe you've got really severe neuropathy, some diabetic sores, anything where shaking just kind of hurts right now. On oscillating, wide is more shake, close is less shake. So it does take a little bit more understanding in how to manipulate depending on you, your tolerance, and the position. But it's usually the first manual setting on your machine, and all of my sessions are related to oscillating. So programs are not universal between models. So when I get questions like, oh, should I use P2 or P7 for my neuropathy? I don't know your neuropathy, and I don't know what plate you're using. So there's always a little bit more to the equation. I'm sorry, guys, you'll never get the cookie cutter answer from me. Sabrina has the Wave 3D only new, so it's still learning. Used to see what's best for me. I've got a number of sessions that I've done for Life Pro, and I have my own channel and my own groups as well. I've got a very short getting started video, and I will drop that after I get off the live today, and I will also offer a link to all of the sessions that I've done at Life Pro. I don't have as many as Rosanna and Amber, but I'm getting close to a couple of hundred myself. There is so much help in this group, you guys. You have no idea. And depending on where you're joining me from, if you're watching me on the main Life Pro page, you should be able to make comments during the live. If you're in the VIP group and you're typing away, or you're in one of my groups and you're typing away and Debbie's not answering you, I'm not ignoring you. I do not see all of the comments from all the tangents that this is being streamed out to. So if you do want to participate in these lives, make sure that you join me through the event, the original event posting on the main Life Pro Fitness page. And then you can nag at me. Thanks, Teresa. I appreciate that. And that's awesome that you're getting started. The Turbo is a cool model. So is the Hover. We don't talk about those sometimes enough. To those of you that have them, every motor or every movement that a machine has is more, it looks like I have a big unibrow with the way that the shadow is sitting me. I have to step away. The Turbo or the Hover have two different movement types. They both have oscillating. The Turbo has pulsation. So you have movement 1, movement 2, and the combination makes it the 3D if you wanted to combine the two. The Hover is oscillating and lateral. So it's that side to side movement. So again, two movements. If you combine them, the third is where the 3D terminology comes from. There is not one better than the other. Again, oscillating is where the most benefits, the most research, and the most control over the experience. Again, it just takes a little bit of time to understand that you're in control. With pulsation and lateral, what I refer to as displacement, which we don't talk about enough, the amount that you're moving each time the plate is moving is fixed, or you can't fix it yourself. So on pulsation, depending if you're using a program, but you'll feel it feels stronger and then it feels less strong. That means it's moving more or less. Lateral, side to side, it doesn't matter if your feet are wider or closer, you can't manipulate the amount of movement in the same way that you can in oscillating. Oscillating is also the most natural. That's how we walk across the floor. It mimics that movement. Because the vibration alternates somewhat, it's the least amount of head movement. Not that that's a bad thing, but for those of you with sensitivities or you just don't like it, oscillating also presents the least amount. And I do get that comment from some of my lateral diehards as well, that they like lateral because there is less head movement. So it really depends on you. Went off on a bit of a tangent there. Teresa has the Rhythm and the Waver as well. So the Rhythm is kind of the last of the old machines as far as look. You'll notice if you go back on the internet 10, 15 years, everything looked like the Rhythm. It had these handles. And a lot of this is you guys. I want this and I want that. A lot of you think that you need handles because you have poor balance. You will improve in one session. Balance is the first thing to improve on a vibration plate. And if you use it regularly, it's the first thing that's going to stick around long term. So I deal with a lot of special needs and larger users where sometimes those handles get in the way. So, you've progressed and you're getting to the point where you're wanting to do some of the weights, or maybe you're getting down on the ground. Sometimes the handles present less space because they're in the way. And the plate surface itself on that design of a machine is a little bit smaller than the Waver and the Rumblex, where they're a little bit wider. So the larger a plate, the more amplitude that you have to play with, because you, like a teeter-totter, the wider out, the more you're going to move. And the nice part about the Turbo and the Hover that I was sort of getting off on, because there's two movements, they're not quite as heavy as the Rumblex. Each movement requires its own motor, own components. That's why you'll never get a little itty bitty plate that does it all, because there's physically just not enough room to put all the circuitry and the components to do all the same things this machine does. So if you want something that's cute and can fit under your desk, you're going to get limited features and typically one movement, because it needs to be light, and the more features you add to it, the more the mass. So there's never the perfect plate for every equation. You can lose weight and get bone density and get all the benefits of all of the machines. It's the consistency in using it and the exercises that you're doing. Now, certainly there is different performance sometimes between them. Even with the red lights or the infrared, there's going to be different features. So when you're combining these, I'm not going to give you a whole book of recipes over what setting combines best with this. Just use whatever settings you would normally use on your red light or your infrared if you're combining with these. If you're starting 2 new things at once, be cautious. If you're dealing with something acute or chronic and you have a setback and you started 5 new things this week, what did it? Was it overdoing everything? Was it the red light? Was it the machine? So if you are starting any of these technologies for the first time, get used to them on your own. Figure out your comfort zone, what settings you like, what settings you don't like before you start introducing other things. Kind of like medications. I don't like to talk about medications, but you give a pill 30 months, you'd give your body 30 months. But when it comes to these technologies, somehow everybody expects Life Pro and Joel to have a miracle by tomorrow morning. We expect instant healing when it comes to our technology, or we should be in shape overnight. Give it some time, and it probably took more than a day or two for you to get to the body that you're in if you're trying to change it. So be patient with yourself, and don't give up after 2 or 3 sessions if you're not seeing relief. We don't heal and we don't get fit instantly. I hope that makes sense. The pressure of the New Year's is off, so stop beating yourself up. I don't know if I have any other questions here. I'm just going to take a quick look-see. I think that's probably it for today. If you are watching me on a recorded basis and you have questions about any of the moves I did today, or combining any of these treatments, I gotta stop saying treatments. I'm not in the clinic. Therapies, tools, there's a million things for them. If you have any contraindication questions or any of those type of things, keep in mind care providers have so much to know. They can't be the experts in everything. A lot of times things that come out of my mouth do contradict what the medical community says, but I have 20 odd years experience. So it doesn't mean there's ever a black and white answer, even when it comes to those things. With modifications, seated in a stool, putting one leg on at a time, there's all kinds of ways that you can modify your use on a plate, just like you may reduce the amount of time or use a more moderate setting on your light therapies, let's say. So there's always a way to modify your approach if you do have a setback or if you're dealing with a condition short term. So thank you for joining me. I appreciate seeing you guys today, and I look forward to seeing you again next week, where I'll be combining some red light ideas, or some infrared ideas, and just giving you some tips on best ways to incorporate your infrared and sauna technology with your vibration plate. And there's going to be 2 goals. There's going to be lymphatic wellness healing approach, and then there's going to be, I'm combining these because I want the burn and I want the fitness. So there's tips depending on what the goals are that are going to vary there, and I'll cover those next week. If you have any questions in the interim, always tag me at Debby with a Y. Today I added some products on your end of the stream. I'm really curious if you got those, and if you did, please make a comment and see if you can tell me what. It doesn't have to be all of them, but just make a comment if you joined me on today's feed, or in the recorded versions, if you're seeing any recommended products on the other end. There is 20% off with Life Pro, of course, right now, site-wide. So check that out. There's new inventory in stock. Perhaps there's something you've been looking at and it wasn't available prior, but I linked in some of those today. Hope I did that right, and let me know what else you might see on your other end. Thanks for joining me. I'm glad you added the weights, Vicki. They're a really viable tool. And I like the adjustability, especially if you're dealing with chronic issues. You got to be able to change gears for those good days and those bad days. Thanks so much for joining me, guys. I'll see you next week. Don't work too hard.